I think everyone studying for AFK exam is looking for this perfect study partner who is available all the time, who can answer your question, who can give you question to practice with him, who can even draw some tables for you. You can ask him to collect this question, collect this causative organism for some specific condition, or how to compare between like hypoglycemic attack and syncope, and he can answer you. Since this AI technology started to be something big 2 years ago, I was looking for something where we can really use it to give you this perfect study partner. I looked everywhere, I paid a lot of money for everything, and the answer was like in my backyard, in my Google account. Today I will share with you the perfect study partner for this one. It's coming from Google, which they called it Notebook LM. So this big story to come in a short sentence, it is a perfect study partner. Let's see why it's perfect study partner. This is Mohammed Musa from AFK Study Plan. Today I'm so excited to share with you this AFK deep dive podcast and the study partner around it. So this, as we said, it's using Google AI. As you can see, this is just the tip of the iceberg. I did each chapter in our course to become in a separate chat where you can chat with the PDF and see how it really can be helpful for you and it's available all the time. Let's start with something super annoying, periodontal surgery. So as you open it here, I did cook it, like I have the sources here, I did add it. Here you have the chat, here you can ask question, you can ask it to make a mind map. I did it from before, so let's see what's the meaning of mind map. So when you click here, yes, it gives you. So this is all the material you need to study in this chapter. So perio surgery, phase 2, we start with phase 2 surgery, why we do the phase 2 basically. So here we have this, the main idea, and if you would like to read, you can read from here. And everything has a source, like I'm not giving you information from like my brain, no, it's coming from a source. Here you can click the source, you can read it, and then if you would like to read more around it, so it can drag you to this PDF. This PDF, I did it from the textbook. So what I did in last cycle, I did go to textbook like Kranza, for example, and other textbook from the resources of AFK, and I did summarize this perio surgery, everything to be condensed, and then we did the course. So what's going on here now, this AI technology is using the resources coming from textbook plus the video I did for this chapter to combine it together to give it to you. So here you have this mind map. You can, like for example, I'm confused about this one. So you can go here, you can see this is the main idea about crown lengthening, and then you can click here, you read. Okay, so this is easy. Like you can do this with other tools, but the really interesting one is the following. This is the podcast. So this is, I did share with my doctor in the full course where you can just hear. So this video is, I think, 2 hours, which was one of the longest video in our course. So it break it down only to 29 minutes. So let's listen together.
Welcome back to the deep dive, everybody. Today we are going to be getting into some pretty intense stuff. We're going to be talking about periodontal surgeries, but don't worry, we've done our homework and we're going to break it all down for you. We're talking everything from managing gum disease and dealing with structural problems in your mouth to getting ready for things like implants or crowns.
Exactly. Now, I know the thought of gum surgery or even bone surgery can be a little intimidating.
Yeah.
But that's why we're here, to really kind of extract the essential knowledge for you guys, why these surgeries are some.
So I love this one because it's like a discussion between two persons. So this is like study partner. You're studying with someone and then you do this discussion. Up till now, it's fine. What's really interesting in the next one. So I did listen to this one before, and then I would like to make him my study partner. So I would like to ask him. So the next part, I don't know what's going to happen, and this makes me nervous a little bit, but this is the main idea of a study partner. I can recommend a study partner for you, but I don't know how he's going to respond to you. So let's see, is it reliable or not? So you can click here, interactive mode, and then you can jump into discussion. Let's see.
Welcome back to the deep dive, everybody. Today we are going to be getting into some
Oh, wait. Someone wants to join. Hey, go for it.
Hello. So I would like to know when we are going to do the perio surgery. What is the cutoff of the probing depth, and what is the clinical indication that indicating we need periodontal surgery intervention?
Hello there. That's a fantastic question, and it's right on point with what we're discussing.
Yes, it's important to understand when surgical intervention becomes necessary. Let's unpack this.
So you're asking about the timing, the probing depths cutoffs, and the clinical signs that tell us it's time for periodontal surgery.
Exactly. Our source mentions that surgery, which they call phase 2 periodontal therapy, is considered after we've done the initial non-surgical treatment, or phase 1.
Right, that initial scaling and root planing to get everything nice and clean.
And then after about 4 to 6 weeks, we do a reevaluation to see how things have healed.
That makes sense. Give the gums some time to calm down.
Now, in terms of probing depth, our source doesn't give a specific hard cutoff number, but it does talk about situations where surgery becomes necessary.
Okay.
For instance, if after that initial cleaning you still have stubborn areas with deep pockets that continue to bleed, even if you're doing a great job with your home care.
So it's not just the number, but the persistence of the problem.
Precisely. The source highlights that if probing depths start at, say, 6 millimeters and reduce to 5, or from 5 to 4, that's improvement.
Good news.
But if you have localized spots where those deep pockets remain and they're still bleeding, that's a key indication that surgical intervention might be needed.
Okay, so it's about those stubborn spots that aren't responding to the initial cleaning.
Absolutely. And the source, oh, go for it.
Yeah, thank you. Okay, so why it's 4 to 6 weeks? What if the patient came after 8 weeks? If the patient, I did phase 1 for him and he came after 8 weeks and he's still bleeding, should I go with perio surgery now?
That's a really insightful question. The 4 to 6 week time frame is generally given for the gums to have enough time to heal initially after that phase 1 therapy.
Exactly. Our source mentions this healing period allows for the formation of what they call the long junctional epithelium. This is when the gum starts to reattach.
So if someone comes in after 8 weeks, you've missed that immediate healing window post cleaning.
Precisely. Our source actually touches on this. It says if a patient comes back after more than 6 weeks, it's no longer considered a reevaluation of the initial therapy.
Oh, interesting. So what does that mean in practical terms?
It means that the situation has likely evolved further. If they're still bleeding after 8 weeks, it indicates ongoing inflammation.
So even though the initial 4 to 6 week window has passed, the continued bleeding is still a sign that things haven't resolved.
Right. And while the initial reevaluation period has passed, the clinical indication for potential surgery, those persistent deep pockets and bleeding despite initial treatment, is still there.
Okay, so the timeline for that specific reevaluation is important, but the underlying problem might still warrant surgical consideration.
Exactly. The 8-week mark means you might need to reassess the entire situation rather than just evaluating the immediate outcome of phase 1. You'd still look at...
Oh yeah, let's hear it.
Nice. Okay, so I read about apically positioned flap and coronally positioned flap, and I'm so confused. Can you tell me the indication, contraindication, and when we do each type of surgery?
Absolutely, that's a great point to clarify. These flap positioning techniques can sound similar, but they have distinct purposes. Let's unpack this.
Yeah, this is where it gets really interesting because how we move the gum tissue makes a big difference.
So let's start with the apically positioned flap. Our source mentions this specifically.
Okay, let's dive in. What's the main idea here?
The key indication for an apically positioned flap is when a patient has a minimal amount of attached gingiva. Our source says less than 3 millimeters.
Got it. So not enough of that firm pink gum tissue.
Exactly. The goal here is to actually increase the zone of attached gingiva. By moving the flap towards the root tip, we end up with more attached tissue after healing.
So we're essentially creating more of that healthy gum.
Precisely. The source also mentions it can be used for pocket reduction and even widening that band of attached tissue.
Okay, so what about contraindications? When wouldn't we do this?
Well, if there's already sufficient attached gingiva, there's really no need to move the flap apically. It might even lead to unnecessary root exposure.
That makes sense. We don't want to cause more problems.
Now let's talk about the coronally positioned flap. Our source touches on this as well, particularly in the context of covering exposed roots.
Ah, okay, so a different goal altogether.
Yes, the primary indication here is to gain root coverage, especially in areas where gums have receded.
So if you see a tooth root that's exposed and maybe sensitive.
Exactly. By moving the flap coronally, meaning towards the crown of the tooth, we aim to cover that exposed root surface with gum tissue.
That sounds like it could really help with sensitivity.
It can. The source mentions this is often done in conjunction with other procedures, like connective tissue graft, to get the best coverage, especially for multiple teeth or larger areas of recession.
Interesting. So when would we not?
Yes, I'm so impressed with this, honestly, guys. Like, I didn't know the answer. I was a little confused and a little stressed what he's going to answer, but like it was an amazing discussion. I don't know what do you think, but again, like we did all this for each chapter. I didn't finish everything yet because like I'm still in the process of this like experimental and making sure everything's fine. So we have like here, for example, we like this one, antimicrobial for antibiotic. You can have it here, you can add note, you can get this mind map, you can hear this audio, you can intervene with this one. So study guide, it will give you some question from this one, frequently asked question as the name implies. So it's really interesting, it's really interactive, I really like it. Everyone in our full course will have access for this podcast, will have access for this one, and we are going to add this podcast only, not the interactive element, podcast only. We are going to add it to the MOOC package. So if you are enrolled in the MOOC package, you don't need to make anything. I will just add it to your course. If you would like to gain access for everything, the interactive element, interaction with the one, you can go and join our full course. As usual, we provide payment plan and we provide support till you pass your exam. Please feel free to send me any question around it and enjoy. Thank you.